as I'm speaking, my staff is sitting right opposite me. And usually, whenever I give an interview, they write down the answers also and they email you the answers to your specific questions. That way, it becomes
Okay.
easier for you also.
That would be
They can
great.
even,
That would be helpful as well.
yeah,
Yes, so it will be easy for us as well because what we do is whenever we begin the narrative, we have to go to the entire transcript file and then we have to
exactly. तो वो
understand
आपको
the
कह देंगे बेटा
answers.
आप साथ साथ में लिख लेना जो भी whatever I'm speaking, they will she will just type it out. आपके लिए easy हो जाएगा.
Definitely. Yes.
Yeah, that's easier. And also another thing is that she's just telling me that जहाँ पे आपने लिखा ना डॉक्टर सबरवाल उसको आप डॉक्टर ग्लॉसी कर दीजिएगा हर जगह because we are a family
Okay.
of 156 plus doctors.
Okay.
So it's better that everybody is Dr. Sabharwal. It's better that we
Okay.
talk about Dr. Glossy. Yeah.
Great. Noted.
Yes, please.
So yes, to begin with, good afternoon, Dr. Glossy Sabharwal. We at Insights Care India are very excited. It's our pleasure to welcome you and your clinic as one of the top 5 radiology companies in India, pioneers in advanced medical imaging. So, as we know, you're a highly respected radiologist based in Delhi, and you're also known for your expertise in women's health and interventional radiology. So, to begin with, Dr. Glossy, could you please tell us a bit about yourself and what inspired you to pursue a career specifically in this area of radiology?
Thank you so much. And I'm really, I feel very privileged because my vision and my mission is to aspire other doctors to bridge that gap. Let's get started with what exactly made me join my journey. As a 11 or 12-year old, I'm from Amritsar. I never imagined to become a radiologist. It's a very specialized branch and not very well talked about. My parents encouraged me to pursue medicine, and I was very captivated by the human body. My father used to encourage me a lot that how fascinating it is. The heart is beating, the pulse is
Right.
throbbing in your wrist. So although my parents aren't doctor, my father is an army officer. I was fortunate to get married into a family of 156 plus doctors. We are a family of 5 generations of doctors by the name Jeevan Mala Hospital. So that was something that I think I feel I got into it. I explored various fields. Uh, Growing up, yes, I was very attracted to being a doctor, but not in this field. After I completed my MBBS from Government Medical College, Amritsar, I pursued my fellowship at Cleveland Clinic in Ohio,
Okay.
United States.
Okay.
There, I received training in various fields, including women health, radiology, oncology, breast cancer, all of that. And during that time, I realized that my calling is not only radiology, not
Mhm.
only diagnostics, but it is way beyond that. It is a collective effect on the patient care, which means that preventative health to diagnosing to treatment.
Okay.
So, this is in radiology, you can do that. You're very fortunate that you can do that. So, that's how I got very attracted towards imaging, diagnostics, and radiology because it is a mix of academics,
Mhm.
research,
Mhm.
preventative health, guiding the patients, treating, diagnosing, and treating. So it has a vast field that one can explore. So it's very exciting, and every time new things are coming up.
Right.
So also, I'm doing a fellowship in gynecology and obstetrics to complement my interest in radiology in women health, especially.
Mhm. That's wonderful. So glad to know. Moving ahead with the next question, what do you think are the most significant advancements today in medical imaging over the past decade?
See, the past decade has shown tremendous growth in medical imaging. We are very happy to see the growth happening in India.
Right.
Uh, for example, 3D mammography. tomosynthesis for breast cancer. Earlier,
Mhm.
we used to have 2D mammogram. 2D mammogram is reading the book from the front cover and the back cover. But
Okay.
3D mammography is when you are going through the pages of the book. So
In
you can
detail.
imagine, yeah, that you are doing a detailed study of the breast to rule out cancer at a very pre-stage, wherein you can save the breast also. You
Mm.
increase the life expectancy of the patient. So 3D mammography, I feel, is number one in um our field of radiology as an advancement. Then high resolution MRI has come. Then assisted imaging, the AI plays a
Mhm.
great role.
Right.
Also, teleradiology, I feel, is connecting the rural and the urban areas. So the technicians are doing scans sitting somewhere in the rural area, and we are getting the images. We are able to help patients. So these are some of the, to name a few, medical imaging
Right.
which have directly impacted patient care.
Thank you for answering that. So, like you said, you are coming from different, you are coming from Amritsar, but then you have your institute in Delhi. But apart from India, you have a lot of experience from abroad as well. So, how does all these experience influence your practice and approach to radiology?
See, my experiences in India and abroad have been profoundly shaping my career because this is a blend of both worlds. In India,
Mm-hmm.
I had the opportunity before also because, as I told you, I'm from Government Medical College, Amritsar, from a diverse setup of government institutions to the private setup to working in different parts of the country. This helped me to understand that how to make use of the resources that I have. हर एक जगह पे हर एक चीज नहीं होती है,
Yeah,
कहीं पे
right,
सीटी स्कैन नहीं है, कहीं पे अल्ट्रासाउंड नहीं है, कहीं पे एक्सरे नहीं है. So how do you become, you utilize the resources that you have, and in that limited field, how to give best patient care. So that I
right.
learned when I was in India. Then I went to US, where there are cutting edge technologies. In Cleveland Clinic, in Paris, I did my fellowship in breast intervention.
Mm-hmm.
There it was a different culture altogether. Then I came back to India. I did my MD from Nagpur in radiology. Then I did my fellowship from Chennai in breast cancer. So all of this, when I came back and I started practicing, and I never left practice even while I was doing my fellowships, I feel that the approach is centered number one towards my patient. It is a very patient centric.
Right.
I will not tell my patient to get 10 tests done and then we will see. No, it has to be individualized. And
Yes.
coming with a preventative mindset. Why mammography? Why not only ultrasound? Why this? So that I tell my patients, educate them, talk to them, the importance of self breast examination. So, number one is patient centric care. Number two is preventative mindset. That all was possible because different parts of the world taught me the importance of one thing or the other. And most
Right.
important, which doctors in India lack, is that curiosity to learn, that
Uh,
continuous learning. You know, once you become MD, after that you feel, acha, fellowship kyun karni hai? It is not about just adding another
yes.
degree to your already degrees, but you have to update your knowledge.
Right.
Unless you go out and learn, unless you become a student again, you will not be able to understand the lab. And that is what happens. So these are the things which have helped me.
Right. Upskilling is always necessary no matter where you are.
Absolutely spot on. That's what.
Yes. Okay. So coming to my next question. So in your opinion, for your clinic, Dr. Glossy Sabharwal, apart from other radiology companies, what sets you apart?
See, as a healthcare professional, I have observed a significant gap in our country's healthcare system. There is, the segregation of women health services across separate branches. Suppose I have a problem. So my gynecology, radiology, general medicine, everything
Mhm.
is separate. मेरा सिर दुख रहा है तो मैं किसके पास जाऊं, मेरा पेट में दर्द है तो मैं किसके पास जाऊं, मेरे इन्फेक्शन है तो मैं किसके पास जाऊं लोअर एब्डोमेन में. So all this leads to fragmented patient care. Currently, the medical
Right.
professionals are limited to specializing in India in one area of field, either a gynecologist or a radiologist or a general physician, like that. Now, this restrictive approach hinders comprehensive patient care. I envision a more integrated approach. So
Mhm.
my aim is that healthcare should be a holistic approach. A family medicine doctor, an internal medicine doctor, somebody who takes complete charge of you as a healthcare physician. So that
Right.
comprehensive healthcare under one roof, so that एक जगह से दूसरी जगह आप नहीं जा रहे हो. Nobody
Yes.
wants to do that. As a doctor, I aspire to inspire and encourage fellow healthcare
Right.
professionals to adopt a more inclusive, patient-centric approach. You can
Yes.
bridge the gap in our healthcare system and provide a very effective, empathetic care. And it's not just about advancements in technologies and all. It's about a comprehensive
Mhm.
patient-centric care. So that's what
Yes.
I believe in.
Yes, so coming to my next question, when you say advancements in technology, like you said in India, you had to like the optimum utilization of resources is what we call. And then when you move to US, you got to see there are a lot of cutting edge technologies. So what do you think the role technology
Absolutely.
plays in enhancing, diagnostic accuracy, specifically in radiology?
See, in radiology, technology plays a very important role. If you have a high resolution imaging like CT scans, you've got
Mhm.
hybrid CT scanners, good MRI machines, AI,
Right,
all these machine learning. If there is a small stone, if I talk about a patient and that there is a small stone, it will not be seen if my machine is not a high tech machine. I'll
correct.
miss the diagnosis. So if I have high resolution imaging, if I
Mhm.
have AI and machine learning, if I have PACS, what we call the picture archiving and communication system in radiology, all this connects us from rural to urban, from patient to
Right,
patient, from doctor to doctor. So it becomes a easier, faster approach with the radiology information system. All these are the RIS, the PACS, all these are part of radiology technology, and they are very important because they increase the patient care chances of
right,
diagnosis, decrease the time that we take to diagnose and treat the patient, which is very important for a patient who's in pain.
right. So thank you for answering that. But while we are discussing, you must have had your, I guess, almost 2 decades of experience. If we were looking at, it was 19 years of
Yes,
experience in specific. So
yes.
I'm sure in that journey, you must have faced your own set of challenges. So if you
Mm.
can discuss any particular challenge that you must have encountered and what was your approach towards it, we would be very happy to know. And it, I'm sure it will be a very
Just
inspiring answer. Yeah. Sure.
just hold for a second.
Sure,
There's
sure.
one phone call. Yeah. Okay. So yes, one case I very distinctly remember. The patient had come from south of India.
Okay.
A girl, 28 years old. I remember because we have published a case also, a case study
Okay.
on that. That 28-year-old girl was unmarried, bleeding from the umbilicus, जो हमारा navel होता है,
Mm,
वहां से there was bleeding.
okay.
Any history of surgery? No. एनी हिस्ट्री ऑफ ट्रॉमा नो. तो क्या हो रहा था, वहां पे इन्फेक्शन हो गई थी और उसको दे वर ट्रीटिंग दैट पार्ट फॉर omphalitis or infection, and they thought that this is infection which has got into an abscess which has become an ulcer which is bleeding. She kept on
Mm,
bleeding, bleeding, bleeding for years and years. At least 4 to 5 years she was suffering. Finally somebody told her to go to Delhi and get it checked at a good hospital. So she happened to come to us. When she came to my hospital, we did everything, and there was a lump which was bleeding. The one question that was asked that helped, I would say I was at the right time at the right place, that I asked that question to the patient, that is this bleeding related to your cycles? And she said
um,
yes.
oh,
That question triggered the diagnosis of a very rare condition called primary umbilical endometriosis.
okay.
This condition, the incidence is 0.5% of all the cases of endometriosis, which is very rare. So this case, then obviously once the diagnosis was made, we did the histopathology, we confirmed the case, we did the surgery, and the patient improved, and she could not believe it. That one trigger question asked, that आपके periods के time पे ये bleeding होती है. Usually the cases of scar endometriosis happens जब आपकी पहले कोई surgery हुई होती है. So since you don't have a history of surgery, it is very difficult to diagnose that. So that was a challenging case, and the patient was very happy and very comfortable. And now she's married. She has a child, and we are
Wow,
very happy. So one feels very
it's
satisfied.
very
You know
inspiring. Yes,
that high that you get. So no amount of nothing can give you that as a doctor.
nothing can
That
replace that.
replace that. That's true. So that is
Yes,
quite an impressive case that I like to tell because my patient is very happy.
very
Simple as
inspiring.
that.
It's very inspiring. I
Thank
would
you.
really love to read that case, the case study, and go through it
Yes,
in detail to understand.
we have a publication on that. Yes,
Yeah,
thank
please
you.
do share it with us.
We'll do it. We'll do it.
Yes.
Absolutely.
So, moving ahead, we talk about a lot of future advances of artificial intelligence, machine learning. In your opinion, how do you foresee the future of radiology in these cases?
See, I personally feel that it has streamlined our work. So
Okay.
even if I'm not feeling too well, I cannot attend to the patient directly with my AI, with my machine learning, with my PAC system, wherever in the world I am approachable to my patient. It streamlines my error. And what I foresee is that, especially in rural part of the country where there are no doctors and the doctor population is going further down, people don't want to get into such a committed branch. There, the role of teleradiology is so important that this advancement is going to be a boom for us. So in future, any part of the country that we are in, we will
Mhm.
be connected. We will be able
Right.
to get a doctor, whether it is midnight or it is early morning, because even the doctor is comfortable sitting at home and opening a computer and getting all the scans and talking
Yes.
to the patient and giving the treatment. The patient is
Yes.
also comfortable. There is cost cutting also. So all of this, and with AI, the errors are reduced.
Right.
So that is the future of Indian radiology where I see it, and that's my dream. I hope the country healthcare system supports me to fulfill that dream, that every corner of the nation has a doctor approach, approachable doctor. I would say that
Right.
that place is approachable doctor is available, whether virtual or in
Yes.
person.
Right. Yes. So, moving ahead, if you had to give any advice to the young radiologists who are entering this field today, what would it be?
Um, my professors have taught me, and they
Mm-hmm.
always told me that Glossy, as a student, we loved the curiosity you had, and they said that always keep the three C's in mind. I keep the three C's in mind. Number one and foremost is being curious and keep learning. If you lose your curiosity as a child, like how curious a child is, you will never learn. So, fellow radiologists, number one, be curious and keep learning. Number two, communication. Communicate with your patients, communicate with your fellow doctors. It's a teamwork. The more you communicate, the better will be the patient outcome. So, our aim is that. And third, with resources. I try to do the maximum that I can. So once a year, I make sure that I'm enrolling in a learning program. Once a year, I make sure that I get at least some academic publication or something. So these three C's: be curious, communication with your patients and fellow doctors, and collaboration with the research institute. These three things are very important. Every radiologist, every budding doctor must do it. You will have a very fulfilling career.
Yes. I guess not just the doctor, be it any field, these three C's are very important part of all our
Very
lives.
important.
Yes. For
Absolutely.
us,
Yes,
it
you're
equally
spot on
plays an
correct.
important role.
Yes.
Yes.
Yes, that's true.
Right. So moving ahead, if we talk about collaboration, how important is collaboration with other healthcare professionals in, ensuring comprehensive patient care?
As I told you, this is the most important, it's the crux. In India, it's like my patient, I power. Unless we have that kind of group practice, we cannot succeed as a nation. Outside in US, what I experienced was they have joint practices. It's a tradition there of having joint practices. Five doctors
Okay.
collaborate together, form a clinic under one roof, everything is there. But here it becomes I, my.
Yes.
That I, my approach has to go to we, our approach. And if there is a conflict, talk, communicate. There is always a way out. And your talking as a doctor must be backed up with the research. Not that mujhe lagta hai, it has to come with the research. It has
Right.
to come with your books, it has to come with that knowledge. So that is very important, clubbed with your experience. So as a radiologist, you have the power to build a fantastic team of your own. So avail that power. Don't think you are just a radiologist who's doing a scan. No, you have that power, so avail it.
Yes, I to V is very important. So moving ahead with our next question, I guess we have a last three questions left. Um, yes, the next question is, how do you ensure, that your practice, the daily practices that you're doing in your field, should remain at the forefront of innovation in medical imaging? How do you keep up with that?
Yeah, so for me, innovation in medical imaging isn't about staying exactly at the forefront, to be honest.
Okay.
For me, it is about using that knowledge to make a meaningful impact on my patients' lives. As a healthcare landscape and everything that is, it has evolved, it is very important to adapt and prioritize what truly matters. That is compassionate patient care.
Absolutely.
So sometimes this means that taking a step back and reassuring and reassessing ourselves that, okay, what we are doing is correct. If I say that there is a breast lump and I want to do ultrasound, MRI, biopsy, okay, that is what the protocol says. But step back, reassess before putting that patient under so many things. So, focusing on preventative and holistic well being, we can empower the patients with longevity and good health. So, my goal is to make positive difference in my patients' lives by embracing patient-centric approach. We can create a better country health
Right.
overall. So
Yes.
that is important. I'm on top of the technology. No, it's not that. My technology goes back to my roots, and that says that does my patient need it?
Right.
That's
Yes,
important.
thank you for answering that. Yes. So, moving ahead, like we were discussing, based on the technologies and everything, how it should be available from rural to urban states. So now, what impact do you think teleradiology in specific has had on patient care, especially if we discuss about the rural sectors in India?
See, in India, the medical practice is quite a bit in the rural areas where it is suffering also a lot. I have worked
Okay.
in the villages. I have worked in the
Okay.
villages of Punjab. I have worked in the villages of Nagpur. And I
Mhm.
know how bad it is, the state of healthcare there. There are no
Right.
doctors, there are no facilities, not even an X ray machine. What do you do? So, if we put up one center there with the technology, with a technician, and make it with PACS and RIS systems connected to the radiology through teleradiology,
Mhm.
then there is 24/7 availability.
Right.
The rural urban gap is bridged. We can reduce the cost, the time,
Mhm.
and also if one radiologist has approached a case and the treating doctor feels that this is not right, multiple opinions can be taken. You
Yes.
don't have to go anywhere, you don't have to send patients anywhere, you just have to transfer the images, which is like a
Right.
second's job. So all of this again makes better patient centric approach. So this is very good, very important, and we must continue to explore more options in it so that the work is streamlined.
Right. Yes, that holds a lot of importance, especially in case of patient that
Yeah,
he or she doesn't have to travel a lot. Instead, they can be at a
exactly.
place where doctors can take different opinions through the images and everything.
Absolutely.
Yes,
Absolutely.
yes, thank you. So moving ahead, the last question from my side. So looking ahead, what are your goals, Dr. Glossy Sabharwal? And what do you think your role is in shaping the future of radiology in India?
See, I am very vocal about it that, and I want to manifest it also. I want to develop a patient-centric preventative healthcare system in India, which
Mhm.
is available,
Right.
which is affordable, and which is accurate. My country has people, a lot of people. So I need the availability, number one, the affordability, number two, and the accuracy, number three. So all these three things in a patient-centric preventative healthcare is what I am looking at. And if I can do that, then I have achieved my aim. So it's not only to make advancements in the field of radiology, but to make a difference in the lives of people of India when it comes to healthcare. So that is what it is, and I hope that it's inspiring, it's encouraging to all the fellow radiologists, the young radiologists, that please, you have the power, avail it.
Definitely. So, thank you for answering my questions. That was the last question from my end. But before moving ahead, just wanted to know if there are any additional details that you want to add. So, you can just let us know if we have missed out on something.
Hmm. So one thing that I would like for my fellow radiologists, if you have done your MBBS and you have done your MD, please do not think that that is the end of your learning. You can do a lot of fellowships. You can do whatever your interest is. Like my interest was in women health and imaging.
Mhm.
So obviously in India, you cannot do a double MD. You can either
Okay.
be MD in one field or the other, but you
Okay.
can pursue as a fellowship. So it is very important for you to continue doing it
Right.
and make sure that you are taking it forward and not stopping it. As far as this is my advice to the fellow radiologists, now my advice to the patients are that please get yourself regularly checked and screened. It is very, very important as a part of a annual health checkup. Do
Mhm.
not ignore your health, listen to your body. And in case there are any questions, anything you have, feel free to talk to your doctor, take multiple opinions, and we are here to help always. Thank you so much.
Yes, thank you, Dr. Glossy. It was so nice. It was so wonderful to have you here. I feel privileged to take this interview and to understand a lot of details. I'm sure as a normal human being, we don't know how what all we go through when, especially when you spoke about the breast cancer, the 3D machine, that it
Yeah,
scans everything in detail. It was very inspiring
yes,
to know. I'm sure if given a time, if I had some time, I'll go through this things in detail to understand what exactly it is, just to be aware for future references.
absolutely. Anytime.
Yes,
There to
definitely.
help.
Yes. Thank you so much. Thank you once again. If you have any further details, I guess Shruti will get in touch with you regarding the
Sure.
process ahead.
Perfect.
Yes.
Thank you very much. Thank you.
Thank you. Thank you. Yes.